And we begin tonight with the growing opioid crisis in South Carolina. Legislators, law enforcement, and community groups are working to tackle the problem. Doctors are also making sure they're monitoring the number of prescriptions that they write. News 19's Lauren Thomas spoke with a local doctor about how they determine when a patient needs prescription drugs for pain.
From a scale of 1 to 10, that's how patients are asked to rate their pain, 1 being mild pain and 10 being the worst possible. With different levels of pain comes different levels of treatment. That's where physicians have to determine what's best for their patients.
Pain is such a subjective thing.
Lexington medical physician Christopher Cooper works in the ER and says different types of pain call for different types of treatment.
Acute pain is different than chronic pain. Obviously, if somebody comes in with a broken leg, we're not going to say, do you have a problem with addiction? Here's some Tylenol, while we're trying to decide whether or not, you need some medicine. Obviously, we're going to treat the patient and get them out of pain. It's more for chronic pain is when we really start talking about opioid dependence and really being more concerned with opioid-seeking behavior.
When opioids are needed for acute pain or short-term sharp pains like a broken leg, the Center for Disease Control suggests prescribing no more than needed or the lowest effective dose. The CDC also recommends not prescribing opioids for chronic pain or pain that lasts more than 3 months.
A more conservative approach is doing something like Tylenol, scheduling Tylenol, using things like lidocaine patches for localized musculoskeletal pain. Those seem to work very well for a lot of people.
Physical therapy is also recommended to help patients with chronic pain. Dr. Cooper says the goal is to make sure they are not overprescribing.
You don't want people to suffer, but you want to be judicious in the prescribing of medicines because obviously they do cause problems.
In Lexington County, Lauren Thomas, News 19, WLTX.
Well, nearly 5 million opioid prescriptions were filled statewide last year. The state does, however, have a prescription monitoring program that helps keep track of who's being prescribed painkillers and at what rate.